Audio Jungle. Audio Jungle. Audio Jungle. Audio Jungle. As an upcoming medical clerk, all third-year medical students should be knowledgeable in wound preparation and basic suturing techniques. A third-year medical student should know by the heart the basic equipment that is being used in wound preparation and suturing. The required minimum equipment are these. First, you have a scissors, a needle holder, a non-fluid forceps, a silk non-absorbable suture. Also, we are going to need an anesthesia to anesthetize the wound and a cleaning solution.
After explaining the procedure, proceed to gently cleaning the external surface of the wound. Once this has been done, check the expiration of your anesthetic drug, the type you will be using, and concentration. We will be using 1% lidocaine. Proceed injecting the local anesthetic to the wound edges, approaching the wound from the wound site itself and not injecting through the skin. Make sure that the entire wound is anesthetized along both its length from edge to edge. Once the wound has been anesthetized, safely dispose the syringe and allow the local anesthetic enough time to work. After an appropriate passage of time, test the wound edge and confirm that your anesthesia has been successful. Once anesthetized, it is now appropriate to clean a bit more vigorously, including the inside of the wound, and to properly irrigate if there is any foreign material. This should now cause less discomfort or pain to the patient.
Once the skin has been prepared, proceed to suturing. The needle holder should be held placing the thumb and the fourth or ring finger into the loops and placing the index finger onto fulcrum to stabilize and have fine control of the instrument. The needle holder could also be held in the palm while suturing, allowing greater dexterity. While the forceps is held using a ball pen or chopstick position. Now, open your suture. Hold the needle in the tip of the needle holder at approximately 1/3 of distance from the swage or the eye and 2/3 from the tip. This allows for an easier rotation of the wrist to take the needle through the skin. Remember, when suturing a wound, always sew towards yourself.
For a simple interrupted suture, raise the skin from the wound with forceps. Insert the needle at 90 degrees to the skin, 1 cm from the wound edge, and with a rotating motion of the wrist, simply twist the needle and insert on one end, coming out the middle of the wound. Pull the needle through with a needle holder, then raise the opposite skin edge and insert the needle through the wound to dermis, emerging 1 cm away from the wound edge. Pull the suture material through, having just enough to suture on the other side. There are many ways to tie an instrument. One way is the following. Turn twice around the instrument, grab the suture, and pull it across the wound such only enough force should be applied to approximate the wound edge and avoid excessive tension across the wound. Now, rotate the material in opposite direction around the instrument and try another knot to the direction same as before and complete the knot. Pull the knot to one side of the entry edges and cut the suture leaving around 1 cm.
Audio Jungle.
Continue in a similar fashion to close the wound.
Ensure wound edges oppose each other but not overlie each other and are not in tension. Continue in a similar fashion to close the wound. Discard needle in sharp spin and others that are used appropriately in clinical waist bin.
The timing for suture removal depends on the location and the degree of tension around the wound. Before removing the stitches, we have to assess the wound if it is properly healed. Also, we are going to use a gauze and antiseptic solution to clean the area. The suture is gauzed with fine forceps at the knot. Cut the opposite side of the knot at the suture entry point into the skin. The suture is gently pulled out by pulling towards the wound edges, and we repeat the procedure all throughout the stitches.
Nako, maraming salamat po, Dok, ha? Paano ba tong hindi gagaling? Ang galing ng doktor ko.